Hello, and welcome to Over the Binary, the official podcast of Gender Wellness of Los Angeles. My name is Grace O'Connor, licensed marriage and family therapist, and this is my partner, Casey Weitzman.
Hi, I'm Casey Weitzman. I'm the president and founder of Gender Wellness of Los Angeles, and I'm so excited to be with both you, Grace, and Nicole today. This is our, number 7 podcast? Is that correct?
Yep. And to say we are delighted to welcome our special guest for today, Dr. Nicole Siegfried. Did I get that right, Nicole?
You did. It's a hard one. Yes,
you
got it exactly right.
And Nicole is the Chief Clinical Officer for Lightfully Behavioral Health. Dr. Nicole Siegfried is the Chief Clinical Officer for Lightfully Behavioral Health. She's a licensed clinical psychologist and serves as an assistant professor of psychology at University of Alabama at Birmingham. She has worked in mental health for over 20 years and has served in national leadership positions for the last 10 years. She is an international speaker and has published research, magazines, articles, and book chapters in eating disorders, mental health, and suicide. And in welcome contrast to the gravity of mental illness, Nicole radiates a positivity that inspires hopefulness. She believes that recovery is possible for all individuals with mental health disorders and that all individuals are capable and deserving of a life worth living. And that is why we are so happy to welcome you, Nicole.
Thank you so much. Thank you. I'm so excited to be here.
Yeah. Casey, anything you'd like to share about?
Well, there's so many things I want to share about, but again, we've had this kind of in our books for a long time, and I'm also very excited, obviously, that I am on the advisory board of Lightfully, and so I feel even an added passion about Lightfully and some of the things you guys are doing, and so again, I'm also just excited that we're all meeting today.
So maybe as a way to start, Nicole, maybe you can help our audience kind of understand what it is that Lightfully Behavioral Health does, maybe how it might compare to how like gender wellness might treat clients, and then maybe a little bit on how you work with clinicians in private practice and at Lightfully Behavioral Health.
Sure. Yes. So Lightfully is a mental health treatment center, and we have several levels of care, including residential, partial hospitalization, intensive outpatient, and we have virtual intensive outpatient as well. We have adult programs, and we are opening our first adolescent program at the end of this month. That's where I am today. We're doing some team building and some staff training right now. And so I'm here in San Diego as part of that. We're really excited. And we work, we're sort of that middle level of treatment, sort of, I think of it as a sandwich. And so the highest level of treatment for mental health might be in inpatient psych or hospitalization. And then the lowest level might be private practice, seeing your therapist once or twice a week. And we're sort of in the middle. We're the meat and cheese, I guess, of the sandwich. Yep. And so we are the residential, partial hospitalization, and intensive outpatient, a step down for those clients who may have just been hospitalized after a suicide attempt or who may have needed stabilization for their symptoms in that level of safety and containment. And a step up for those clients who aren't responding well in terms of seeing their therapist once or twice a week. Our goal is to help clients really be able to get back to that outpatient level of care where they can do more of that long-term work. But oftentimes their level of suffering or their symptoms really preclude them from being able to do that, and that's where we come in.
Got it. Why did you start Lightfully? What was the impetus behind it?
Yes, well, I have, I never know where to start in my story, so I have been passionate about mental health for a really long time. I wanted to be a psychologist I remember like we had a career fair like in the 7th and 8th grade, where you do the thing. Well, we had one in the 4th grade, and I dressed up as a movie star for that, so I was going to be a movie star. And then like 8th grade, I decided I wanted to be a psychologist. So a lot happened, I guess, between those years. And so I don't know what it says about me that I've, wanted to be a psychologist for that long. So I've been passionate about mental health. I had an eating disorder myself when I was in college, and that made me specifically interested in that population. And so a lot of the work that I did for a long time was in that eating disorder space. I got passionate about mental health specifically really in the past few years because we saw a gap in working in eating disorders. We saw a gap in general mental health treatment. And in the last couple of years, specifically related to the pandemic, we've really seen a need for some of in the meat and cheese levels of care that I was talking about. And there really weren't a lot of options. And in eating disorders, residential care is one of the primary levels of care. But what was interesting to me was that in primary mental health, this was something that really was missing. The traditional treatment was to go to the hospital and then stabilize there and then step down to partial hospitalization.
Yeah.
What we've really seen over the last few years is the need for that interim level of care where people may not need that safety and containment of the hospital, but they need the structure and oversight of residential care. So I know residential care, that's what I've done in eating disorders. And so I felt really excited and saw the need for doing that for general mental health. And so we developed Lightfully to fill that gap.
To address that. That's so great. I'm a big believer in step down level of care. I think it's so imperative.
Yes. Well, and there's something too that's very clinical, I think, about some of the traditional treatments in terms of, the hospitalization, and then even the term partial hospitalization, sort of has this very clinical, sterile feel to it. And we want, recovery to happen in as much of a real life setting as possible. And residential care fills that need.
Right.
Sure, and that's what I was going to say. When I did get to tour one of the facilities in Brentwood, this welcoming, before I even walked through the door, there were all these gay, flags, and there was this sense of embracing. And the staff was so welcoming and positive, and even walking through the milieu, there just felt like this sense of the clinicians and the clients were collaborating and working together, and then seeing the chef. It just felt like a very it doesn't seem like any hospital or a lot of the residential treatment centers probably that both Grace and I have either worked in or seen. It had this just lovely openness and, this positivity, which I've been telling Grace about you exude this positivity in this work that you do. And it really showed when I toured that first facility. And so obviously we're really excited about Encinitas. And then obviously I read that there's going to be one in West Hollywood soon.
Yes. Right now we started with our adult programs. And so that was at the beginning of this year. And now we're on the adolescent side of the year where we're opening our adolescent programs here in the San Diego area. And then we'll open a PHP-IOP in September in the LA area. And then we're opening in San Jose. We're opening adolescent programs up in the San Jose area. So we're covering the state, which is very much, even with all of our new programs, we still will just be making a dent in the need that exists for mental health treatment right now.
So what are you seeing with adolescents? What are you seeing with this population that really kind of stands out for you?
There's several things. I think that even prior to the pandemic, we were seeing an increase in mental health diagnoses and just suffering for our teens. And there were a lot of reasons for that. I think that just was sort of a philosophical 20,000 foot view of where we are in our evolution, speaks to that. We live in a society where the humans that we are the result of our ancestors and how we were able to survive and those genes that were passed on. And so that makes us highly anxious because our ancestors who survived were the ones who were hyper vigilant and saw anything that was out of place and anything that could be an alert to danger that was passed down. And also, and those genes that were passed down are the reasoning and thinking and problem solving genes. And so that's allowed us to be a very advanced race in human race in many ways. But in other ways, psychologically, I think it's caused a lot of problems because we now are seeing where a lot of our youth are very overstimulated in the world that we live in. So we're wired and genetically programmed to be able to be very hyper vigilant, and we live in a world that is very overstimulating in terms of all the bells and whistles and the society that sort of this Times Square kind of life, that is day to day for our youth in terms of social media and video games and that kind of thing. So it's just a perfect storm of where already we were sort of working against ourselves in terms of our psychological health. And the other piece of that is sort of from this evolutionary perspective, we're also wired for connection. I mean, it is imperative, it's for the survival of the species that we were connected to one another because there were strength in numbers. And so we have this genetic predisposition to be connected to one another just for survival. And yet we live in a world that kind of blocks connection. And so there's just all of these competing difficulties and problems that just keep kind of clashing into each other. And our youth are the ones that are having to live through it day by day. And so already with everything that they were dealing with, the pandemic was just the cherry on top kind of, and it was just too much it was so hard for all of us as adults, to go through that. But our youth who missed a couple of years of their middle school or high school traditional experiences where we're supposed to be connecting and creating those groups and that really was impaired and thwarted. And so that's what we're seeing in terms of our youth really struggling with sort of the way their genetic makeup has prepared them for, and then the world that they live in
the modern world. I watched a great interview you did last night on adolescents getting away from social media even for just 1 week and the positive impact.
Yes.
And maybe if I can kind of follow up a little bit on Casey's question, there's by the way, Lightfully Behavioral Health has an amazing website, and they have a blog that they do. And y'all just interviewed Casey, and I thought it was really great because you really highlighted some of the struggles LGBTQ youth face in today's day and age, and that modern technology and our genetics. There's a couple statistics I want to kind of put out there. Lesbian, gay, and bisexual youth are more than twice as likely to experience persistent feelings feelings of sadness or hopelessness than their heterosexual peers, according to the National Alliance on Mental Health. Transgender youth are twice as likely to experience depressive symptoms, seriously consider suicide, or actually attempt suicide than even their cisgender lesbian, gay, or bisexual counterparts. So it's really interesting. I mean, Casey and I really specialize in working with trans and non-binary individuals. Casey, you probably work with transgender youth even more than I do. So can you share a little bit about what particular challenges the trans and non-binary populations might face in a treatment setting?
Absolutely. And I love the stats that you shared. In terms of where we are, in many ways, I think we'd say maybe on paper, it looks like we've come a long way in the last 20 years, but living it out for our youth in the day-to-day experiences of what it means to be trans or non-binary, we still have a really long way to go to be able to live in a world where people feel fully accepted for who they are. And so our trans youth and non-binary youth, especially in a treatment setting, these individuals, we don't have the stats yet for our adolescents, since we're just opening specific to Lightfully, but for our adults, a third of our clients identify as LGBTQ. And I think that's just such a commentary on the discrimination and the hostility of the world that exists. And it's very hard when we're talking about us being wired for connection and belonging to have that, inherent yearning and need, but to live in a society that doesn't accept you. And I would say in many ways, our youth are much more accepting than than adults, and don't have as hard of a time, conceptually around some of the differences in gender and sexual orientation. We live in a world where our youth sometimes are much wiser than we are in terms of acceptance. With that being said, though, there are still so many, we still have such a long way to go. And the depression levels, the anxiety levels that are experienced disproportionately for our trans and non-binary youth are a testament to the discrimination that they continue to experience.
Yeah. And I just think it's wonderful. You put such a focus on the LGBTQ experience in your treatment program. I think it's so imperative and it's so desperately needed. And I love that y'all are as inclusive as you are. I think you're providing a real service to the community. So thank you for that.
Oh, yes. Well, we call ourselves a learning community. We're constantly learning. And part of that is that we learn from mistakes. We're not perfect. And one of our shining commitments is Wabi Sabi, which is learning from mistakes. It's an Asian, Wabi Sabi is the Asian philosophy around that there's beauty in imperfection. And so we carry that with us, knowing that we are learning and that we're continually learning. And when we make mistakes, and we do sometimes, we learn from those.
That's great.
I thought it would be helpful if you talked about sort of some of the process-oriented, what is it, DNAV?
Yeah.
Like, it really sounds like you guys have kind of a unique perspective of how you're treating your kids and adults. I just wonder if you could talk a little bit about that with us.
Yes, yes. So the clinical model that we use for our adults and adolescents is process-based therapy. And I don't know how familiar you all are with
I read up on it. I think
Okay.
it's fantastic.
Well, I feel like this is process-based therapy has put words to what a lot of us have been doing in the field for a long time. And I just didn't have the language to go with it. You know, most of us describe ourselves as eclectic or integrated therapists, where we integrate a variety of modalities. And process-based therapy just provides the strategy and the rhyme and reason for how to do that. The other thing that it does that I think that is really part of what maybe, Casey, like when you were visiting, or what you feel in our programs, is that it's a very non-stigmatizing type of therapy. It's very, we move away from diagnoses as the way of conceptualizing cases or conceptualizing someone's experience. And we look more at processes. And when we're talking about a process, it's basically, I narrow it down to like the way that we interact with ourselves and other people and the world around us. And we have different types of process mechanisms. So the way that I attend to the world around me. And we have adaptive and maladaptive processes. And we are all, you know, as humans, we all have adaptive and maladaptive processes. I give myself as an example all the time. One of my favorite maladaptive processes is I have attentional difficulties where I'm always future tripping. You know, I'm always thinking about tomorrow and down the road and trying to plan and control. And that has gotten me into a lot of trouble in my life because it pulls me away from the present moment. And I think that other people may struggle with attention in different ways, where they're sucked into their past and they're reliving their past and ruminating on their past. And that kind of process, that maladaptive process, shows up in a variety of different disorders, so to speak. And so what we're doing at Lightfully is focusing on these processes, identifying what those are in each of our clients and where their struggle is. And that's kind of beyond or underneath the diagnosis itself. And our goal is that if we can help people interrupt those maladaptive processes and help them develop adaptive processes, this is going to be a much better recipe for a life worth living, rather than just focusing on symptom reduction and coping skills.
Yeah.
And so with our youth, we use, Casey, you talked about DNAV, and it stands for Discoverer, Noticer, Advisor, and Values. And I love this model because the language is so user-friendly for our teens. When we're talking about, instead of saying, let's, talk about emotion regulation, we start talking about our noticer skills. We also talk about our advisor, which I love, because instead of saying, we're going to talk back to negative thoughts, or we're going to restructure negative thoughts, instead, we talk about our advisor. We all have an advisor. And I like to think about it like with kids, we'll sometimes talk about the president has all of his advisors, or her advisors, their advisors. But they don't always have to listen to everything they say, So if we can start to think about our advisor in that way, that some of the advice that it gives isn't always helpful. We can listen to it, and we can choose what to act on and what not to act on. And so if we can equip our youth with that kind of framework and skills early on, this will be something that they can carry with them later, and not just, to use now to overcome their anxiety, so to speak.
Sure. You also talk about social media and FOMO, and I wonder if you could talk about that for a minute, because so many of the clients that I'm working with have catastrophized the future, and are scared of the world out there when they graduate high school or college. The part about gaming and trying to get them off social media has been so challenging. Even when I work with the parents, I'm like, you need to be able to go on their social media, see what they're seeing. But what are you noticing? Because it really feels like young people are getting so much bad information.
Yes,
Yes. Media.
Yes. Well, and I think that contributes to this, living in this like sort of Times Square kind of world, So there's constant stimulation through social media, but then also, what's that old adage that you see everybody's highlight reel rather than their backstage? And so it's this world of where you're living in your own reality, but you're seeing everybody else's highlight reel. And so it's just this kind of fantasy where you feel like you constantly don't measure up. And so adolescence is already such a hard time where you're, kind of defining who you are and establishing your identity. And when you're faced with a constant bombardment of these really unrealistic social media snapshots of people's lives, that can contribute to this feeling of not measuring up. So what I talk about a lot with clients and families, it's so hard because at the same time we talk about this and the contribution that social media has to negative mental health, it also becomes a way of coping. Scrolling is looking through your Instagram and TikTok becomes a way of regulating emotion, and often becomes the only way that our youth have to be able to regulate their emotion. And so it's not as easy as saying like you need to stay away from social media, because it also feels like we're taking away a coping skill. And so what I often talk about is let's start sort of a way to reduce social media. And so one of the ways that has been the most well received for families and youth is we talk about no phone zones. And so a way to reduce time on social media is to say, okay, at the dinner table or during dinner, it's a no phone zone. In the car, it's a no phone zone. And that in and of itself is reducing time on social media, but it's also allowing for the development of relationship and connection and support that becomes another way to regulate. So that I used to have this idea, even in treatment centers, we used to be of the opinion that taking away all electronics was the way to go. And it's not realistic anymore. I think schools are going in the same direction of like, it's impossible to control access to electronics. And so even in our adolescent programs, we've realized that completely taking away electronics is not teaching them how to utilize them in a healthy way. So we still allow electronic time in our adolescent facilities to start the process of like, how can we use this in a healthy way? And then we have times that are without electronics, which is meals and groups, and while they're in program the day.
Well, I find that really helpful because maybe Grace, you could talk more about it, but in the treatment centers that I've referred our trans and non-binary adolescents and adults, the policy has really been no cell phones and no computers. And I agree with you that you can't go, talk about, I don't want to say addiction, but to cut cut people off that are in residential treatment or outpatient. I think it does do a disservice. If you just, because some people that I've placed have said, no, I'm not going into that facility because I can't bring my phone. You know, I can't bring my computer. So I like the philosophy of, limits, but still not cutting that off from the patient that goes into one of the residential treatment centers. Because I think Grace and I would both say that it's been very hard to find good treatment centers for adolescents and our adult trans and non-binary. Maybe you could talk about that, Grace, a little bit, but since you just left a residential treatment program.
I did. I've been, working in treatment for about the last 5 years, but I just recently transferred over into private practice full time. And
Okay.
So yeah, I've had to try to find treatment programs outside of California for LGBTQ clients, and good luck. There's nothing. I mean, I was so disheartened by certain states in this country, many states that have no LGBTQ letters in anywhere on their website. And I'm really encouraged by what we're doing in California and the level of care that we're providing LGBTQ youth and adults, for that matter, in treatment programs. The treatment programs I was involved in, fortunately, were so LGBTQ inclusive. I ran the LGBT program at one of them, and it was so inclusive, and it was wonderful. And the word went out, and I found that the more affirming we were of LGBTQ folks, the more people heard about it. And then they told their friends, and then it got out to the networks. Hey, like, if you want to be affirmed as a trans person or as a non-binary person, like, this treatment center is really great.
Yeah.
So word of mouth does play a part too.
For sure. I think that that's such a commentary, though, on what the experience must be like for our trans and non-binary youth if in their states they can't even get good treatment that is affirming, So what does that even mean? What does that even mean that you have to come to California or go to, another state to be able to get treatment that is affirming? And what does it say about what they might be going back to after treatment? And so, that's something that can get me really fired up.
I hear you. And how important is sexual orientation and gender identity? I mean, how important is that?
Yes.
And like, the whole program doesn't necessarily have to be all LGBTQ, but to have the staff be a reflection of the community, to have them trained properly around, LGBTQ identity issues, and to know something of our history like that. It's imperative.
Right. And I also agree that it's so important that the staff, right, is, I think I read about diversity in your hiring. How has that been for you to hire clinicians and, I don't want to say child care workers, I'm not sure, but staff that is also trans and non-binary? Has that been a challenge for you?
Well, it's always tricky when you're in terms of hiring practices and questions that you can and can't ask. And so in terms of how people identify, we don't always have, we know people's pronouns, but in terms of
that's good.
if there is, oh yes, we definitely use pronouns. But in terms of their cisgender or trans or non-binary, we may not always know that. But I do think that I've worked with someone else who's on our advisory board is Norman Kim, and he works he's worked a lot with LGBTQ as well, but is the founder of the Anti-Racism and Equity in Mental Health Treatment out of New York. And one of the things that we had talked about was how can we build a really diverse culture in terms of our employment or in our employees. And he said, you will be surprised that just the way that you describe your company will make a difference, because people will know if they're welcome. And so from the beginning, we have in advertising as a company that is gender affirming and diverse, we've attracted more of a diverse, employee pool, so to speak. And so it's been interesting just comparing that to other organizations where I've been, because I felt like in terms of creating a more diverse staff, that it would be very, very much an uphill battle. And there has to be intentionality around it. In terms of where you are, advertising and posting makes a difference. Also, in terms of what your leadership looks like in their own, diversity makes a difference. We have an all-female leadership team, and we're very committed to that. And I think that says something about, wanting differences in terms of the traditional hierarchical status or patriarchal status, of companies. And so I think that makes a difference as well.
We've got a few more minutes. This has been so great having you on, Nicole. We are just loving this interview so much. I can see Casey's just smiling away. So we want to ask you a little bit about aftercare. So just to kind of preface this a little bit, Gender Wellness has been wanting to start a couple groups for trans and non-binary youth. And unfortunately, COVID has really played a big part in us being able to do it. A lot of youth and adults for that matter don't want to do virtual. They want to do in person. So we're still kind of trying to figure that out. But we're hoping in the fall to be starting a group for transgender, non-binary preteens, 12 to 17, but also one for adults as well. And I would run one group and Casey would run the other. But it got us thinking a little bit about aftercare and preparing clients for aftercare, and how do you do it, and how much emphasis do you put on it, and how would you collaborate with like a primary, like an individual therapist, like Casey or I, if we had a trans or non-binary client who did your program, how do you prepare them for life after treatment? How do you work with the therapists? Like anything you can run out.
This is great. Yes. Well, so, I started back in the day in private practice. And when I would refer to residential treatment centers, I had very different experiences depending on the center. Sometimes I would never hear from the client would go, and I would never hear anything until they plopped back into my office. And so I learned then the importance of really working closely with the outpatient clinician, and what a difference that made. So that's been something that I've been really committed to in the centers where I've worked, is integrating the outpatient therapist. So we provide weekly updates to the therapist, including the assessment results of where the client is making progress and treatment plans, and then therapist to therapist of where the client is struggling and the things that they'll need to work on when they go back into outpatient. So again, we're learning from our outpatient clinician partners of what things are helpful and what things we can do better. And so we're always trying to improve that communication. Then secondly, in terms of aftercare programming, our clients are followed for a year after their time with us. So they are offered the opportunity for a year of case management services, which just is a check-in each month to make sure that they're still involved in their outpatient, seeing their outpatient therapist. And we also then monitor outcomes for, we haven't been open long enough to do it for 5 years, but we'll be doing it for up to 5 years to see how our clients continue once they're outside of Lightfully. I love to hear that you all are starting a support group, because one of the things that we really want our clients to do is participate in community support groups.
Oh, yeah.
And so we are going to be offering our own support groups, but we have found that what's even more important than alumni having like alumni support groups specifically is getting them involved in community support groups where they'll be more life launching back into the community rather than still being really tied to the nest of residential treatment. And so having opportunities like those that you've suggested, those are the ones that we often encourage for our clients, is to have some specific support group specific to your own experience. So if it's an LGBTQ support group or trans support group or a BIPOC support group that really can speak to your own experience, your own lived experience, those support groups tend to be those that make a bigger difference in our clients' lives.
Yeah, because what I've noticed, what I've noticed in treatment centers when I've placed clients, and they're not even just LGBT, the philosophy is you're done for a while. And so what I've had to do is I've had to tell the executive director, well, I'm not done. I guess my role won't be a therapist. Think of me more as a case manager. But I've even said I want to be part of the treatment team because here we're handing off, I don't want to say our babies, but
yeah,
they need a higher level of care. Obviously we can't do, but it's like when and I can't get a response of like, well, how's the client doing? Or I'd like to have a session. I like that there's flexibility because the group I want to start is for parents. So whenever Grace and I start to see even a adolescent, we always meet with the parents first.
Absolutely.
What are your expectations? Usually the parents are in shock. We've worked on like be positive no matter what, even if you're freaking out that your child is, and parents will now say to us, which I laugh, I wish my kid could just be gay. And I was like, wow, that would have been amazing in my time.
Yes.
And I said, well, sexual orientation. Okay, well, we don't know that, but now we're talking about gender. And that's why with the parents, I guess they're calling me the godmother now. I used to call myself a dinosaur, but godmother, it's like and Grace too, we always meet with the parents first. And we also meet with the child, because a lot of times the parents will say, okay, here you are, you're going into therapy. And it's like, well, if we can't connect, right? Like if the young person only sees us as gatekeepers, which we didn't really talk a lot about today, but this idea that they have to perform for us, right. That can always become sort of problematic. So when I meet with the parents, I get a sense of helping them mourn a bit. Like, I know this is not what you saw for your child, but give it time. And that's why I was asking you about staff and that the clinicians, it's a little bit different training with the transgender and non-binary because we're now in a society that after a couple of presidents left, there's much more of a hostile environment. And so I'm just really pleased to hear what you guys are doing. And then obviously, what we want to do. I don't know. We've been wanting to do it in person, but sometimes I feel like maybe people still aren't ready to come back to in person. I don't know if you've had issues with that, because it also looks like you do a virtual outpatient program too.
Yes. So we've gone the route since COVID. And because our clients are from all over the United States, the community support groups that we've done are virtual. Okay. But I think there is something to be said about in person. I think we just kind of long for that, in person connection.
Yeah.
In depending on what group you're running, the fact that they might be able to go out afterwards to a restaurant and socialize and have dinner. And, I did the group at the LGBT Center, Transgender Perceptions, for years. And it was a support group for a transgender, non-binary people of all ages and races, and we would always go out for dinner afterwards. And it was a way to socialize, and it was a way to get comfortable being in public as your true self. And so, being in person has its advantages as well.
Yeah.
Go ahead. Oh, please, no, right ahead.
I was just going to say, I love what you said, Casey, about having a support group for families, and in talking about our adolescent program. I did really want to mention that our families are such an integral part of treatment, and we have a support group for families as well for our adolescent, our kids that are in our programs that are for current families and alumni families. But with our, I like what you said, that in working with our trans and non-binary youth, of working with the families is such a part of that, and the truth of even that you can have both of being very supportive and creating a loving and affirming environment, and grieving what you thought you were going to have in terms of the life with your kid and what that life was going to look like. And so our therapists, this is part of their training, of working with families to be able to help them through that process.
Okay.
And what's the best way to go about finding Lightfully Behavioral Health? If someone wanted to find out more, or even enter your program, what's the best way to find you, Nicole?
Well, definitely going to our website, which is lightfully.com. And there are phone numbers and ways to chat on the website that you can call directly, but sometimes people like to just check things out first on the website, and then they can do a chat for more information, or email in or call in, and those directions will be on the website.
Great.
Well, we just want to thank you so much for coming today and sharing everything about Lightfully Behavioral Health, and just kind of sharing what you all are doing. And like I said, it is so encouraging to know that we have a direct line to you and your program when we have a client who needs the kind of support that you all provide. So I'm very excited for working with y'all in the future, and just knowing you're there is a great thing.
Thank you so much. I've enjoyed talking with you. Today's been fun.
I agree. So do you want to talk us off the episode, Grace? Do you want to say goodbye?
Well, this has been Over the Binary with Casey and Grace. Always enjoy doing this, and we'll see you next time.